I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com.
How many pills do you take each morning? Many Americans swallow a handful of supplements along with medications. This is the People's Pharmacy with Terry and Joe Graydon.
Natural products are popular. They're sold in pharmacies, supermarkets, and health food stores. But how can you find out how to use them safely?
Are your pharmaceuticals fighting with your supplements? How would you know which herbs or vitamins might interact with your cholesterol-lowering medication?
What about quality? We've been worried about generic drugs made abroad, but supplements get even less oversight from the FDA.
Coming up on the People's Pharmacy, how can you combine supplements, herbs, and medicines safely?
In the People's Pharmacy health headlines, the highly infectious disease measles was actually declared eradicated in the U.S. back in 2000. Now, 25 years later, the U.S. is experiencing a serious outbreak of measles that has sickened nearly 500 people and killed one child. In addition to fever, a rash, and respiratory symptoms, measles can cause complications such as pneumonia, blindness, deafness, and encephalitis. Travelers are at risk if they're unvaccinated and visiting areas where there are outbreaks, such as Texas, New Mexico, Florida, and Kansas. There are also areas in Europe, Africa, and Asia where measles infections are increasing. The WHO is recommending that international travelers make sure they're fully vaccinated. 2 doses of the measles vaccine offer 97% protection against the disease.
This week, the European Heart Rhythm Association met in Vienna. One notable presentation came from Denmark. The investigators tracked sudden cardiac deaths in adults in 2010. There were 6,000 deaths from this unpredictable condition. The authors of the research wanted to know how many of these individuals were also taking antidepressant medications. People who had been taking such drugs for up to 5 years experienced a 56% higher risk of sudden heart death, but those who had been taking antidepressants for more than 6 years faced a more than 2-fold increased risk of cardiac arrest. Middle-aged people between 30 and 39 years of age were 5 times more likely to die of sudden heart problems if they had been taking antidepressants for more than 6 years. Such dose-response curves make the risk more believable. One of the authors stated, quote, exposure time to antidepressants was associated with a higher risk of sudden cardiac death.
Many people choose diet soda or other artificially sweetened beverages in an attempt to control their weight. New research suggests that at least one sugar substitute may not have the desired effect. Researchers at the University of Southern California found that sucralose activates the hypothalamus differently from sugar. They recruited 75 volunteers and solicited their responses after drinking plain water, sugar-sweetened water, or sucralose-sweetened water. The sugar-sweetened beverage helped people feel more satisfied, while the sucralose beverage did not increase blood levels of satiety hormones. Instead, participants reported greater feelings of hunger. Brain imaging indicated that sucralose seems to affect decision-making skills.
There's a growing belief that dementia is in part an inflammatory disorder. Researchers in the Netherlands investigated the impact of long-term use of non-steroidal anti-inflammatory drugs on the chance of developing dementia. The investigators followed nearly 12,000 older people for over 14 years. None had dementia at the start of the study. A total of 9,500 took prescription NSAIDs during that time. More than 2,000 of the participants were diagnosed with dementia during the study. Those who took a non-steroidal anti-inflammatory drug for more than 2 years reduced their risk of developing dementia by about 12%. The authors conclude that prolonged use of anti-inflammatory medication may reduce dementia risk.
The administration has announced tariffs to be applied to imports from Canada, including pharmaceuticals. The drug manufacturing industry in Canada and the U.S. has substantial overlaps, so a group of investigators considered how proposed tariffs might affect the U.S. drug supply and costs. The authors estimate that $3 billion in U.S. pharmaceuticals depend on Canadian manufacturing. Applying 25% tariffs would increase the cost by about $750 million. They point out that even minor changes in the supply chain have resulted in shortages in the past. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. When my grandfather was a practicing pharmacist around the beginning of the 20th century, he mostly dispensed natural products such as digitoxin derived from foxglove, or the cough medicine terpene hydrate, or the malaria treatment quinine. Those days are long gone, but today's pharmacies have gone from an exclusive focus on pharmaceuticals to selling a wide range of natural products.
Do you take any vitamins? What about herbs or other dietary supplements? Millions of Americans take turmeric or its active ingredient curcumin to ease their joint pain. Others use melatonin to get to sleep. Some folks like to take St. John's wort for their mood or garlic for cardiovascular health. How do you choose which supplements to take?
Well, perhaps you go online to see what you can learn about a supplement, but how reliable is that information? You need to know about quality as well as how to combine supplements, herbs, and medicines safely.
To learn more about that, we're speaking with Ms. Katie Jantz. She's a pharmacist and a researcher for the informational website examine.com.
Welcome to the People's Pharmacy, Katie Jantz.
Hi, thanks so much for having me.
Katie, we are really delighted to be talking to you today about examine.com. It's such a wonderful resource. I use it quite frequently when I want to look up a supplement. And I also find that it's very helpful in following up on research that has been done. We are interested in this new project that you're involved with. Can you tell us about it, please?
And tell us a little bit more about Examine, if you would.
Sure. So, Examine is an online resource for nutrition and supplement research. So, we have a team of researchers who is kind of reading and summarizing all of the latest research that comes out about various health topics, heavily like supplements, and then also some behavioral interventions as well, like diet or certain types of exercise. So essentially, the goal of Examine is to be a reliable source of current and evidence-based information about nutrition and supplements. So we have been working on a new project over the last year and some months, which is the Examine Safety Database. So right now we do a pretty good job of addressing the efficacy of supplements for different health outcomes, but one of the features that we are going to be expanding is our coverage of supplement safety. So essentially, this Examine Safety Database will provide a more thorough and consistent analysis of supplement safety, including precautions for just the general user as well as specific populations, adverse effects, drug interactions, safety during pregnancy and lactation, and quality concerns such as cases of adulteration, contamination, or even just supplements that are, frequently found to contain more or less of the active ingredient than the label would suggest.
One of the things that I really like about Examine is that you do make certain recommendations about quality. So, for example, you talk about turmeric and the Mariva brand, or looking for BCM 95. Can you tell us a little bit about how you evaluate supplements?
Yeah, so I mean, in the continuous case of curcumin, it's a compound that is just very consistently difficult for our bodies to absorb. So Mariva and BCM95 are both standardized extracts of curcumin that have been formulated in a way to promote their bioavailability, which is essentially the kind of percent of a compound that you take orally, how much of it is actually going to end up in your blood. So when we are, making those types of recommendations, we would be looking at, okay, let's pull all of the randomized control trials that have looked at this compound and look for trends in terms of effectiveness with different formulations, and then also consider, you know, maybe this compound, like say Mariva, has been compared to just a standard curcumin supplement, and bioavailability has been assessed. If we see that, okay, Mariva is going to have, X% better bioavailability, then it makes sense to, choose that preferentially if you can.
Now, what uses do people put to a supplement like curcumin? Why would anyone take it?
So probably the best studied use of curcumin is for inflammation, specifically in certain types of chronic inflammatory diseases such as osteoarthritis. It does seem to produce, moderate to large improvements in pain and joint function in that condition. But there's also some, potential benefits in other inflammatory conditions such as inflammatory bowel disease and even depression.
Katie, I'm wondering if you can share with us perhaps some of the supplements that seem to be most popular, and what are people using them for?
Sure. So, I mean, people use supplements for a wide range of reasons. One that is very, very commonly used and also arguably one of the best studied supplements out there is creatine. So, creatine is most often used for improving exercise performance. It basically helps to build up a cellular source of fast energy for your muscles.
Well, let me ask you about a different supplement, one that actually is a botanical that has had a fair amount of popularity, but I think also healthcare providers are somewhat aware of the potential dangers of interaction, and that would be St. John's wort. People take it to improve their mood if they're feeling a bit depressed, and there is indication that it can be helpful for that, but it also can interact with some medications. Can you tell us about that?
Yeah, so St. John's wort is a very commonly used herbal product, and it is kind of notorious for the risk of drug interactions because it can interact with some of our major drug metabolizing enzymes in our body. So those are called the cytochrome P450 enzymes, and St. John's wort specifically induces one of these cytochrome enzymes called CYP3A4. So CYP3A4 is really important for drug metabolism. It's involved in the metabolism of over 50% of medications. So there are, I think there are just hundreds of potential drug interactions with St. John's wort. So how St. John's wort affects this enzyme is that it induces it, which essentially means it increases the activity level of that enzyme. So for the most part, that enzyme, its job is to take that medication that we've put into our body and metabolize it, which generally results in a reduced drug level. It helps our body get rid of that medication. So if we introduce a herbal product like St. John's wort that increases the activity of that enzyme, you can actually end up removing the medication from your body far quicker than normal, which can reduce the effectiveness of many medications that are commonly used, including like birth control, medications used to treat HIV, or medications used to prevent organ rejection. So some medications that can have really detrimental outcomes if their effects are not being achieved.
That's a really important point because for someone who has an organ transplant, say a kidney transplant or a liver transplant, having that rejection medicine work less effectively could be a matter of life and death. I'd like to move on to two other herbs that work in a completely different way regarding that enzyme you're talking about. One is called berberine, and berberine is very popular these days. And the other one is ginger, and that also is popular. A lot of people love ginger tea. Well, both of these herbal products apparently can inhibit that enzyme, that 3A4 enzyme. So it's affected in just the opposite way of St. John's wort. What would happen for a medicine that depends on that enzyme that's not working as well anymore if they're taking berberine or ginger?
Right. So, like you said, when we have an herbal product that's inhibiting this enzyme rather than inducing it, like the St. John's wort, you end up with a reduction in drug metabolism. So, as opposed to the drug being removed from the body too quickly, the drug remains in the body longer and potentially at higher levels than we would normally hope for. So when you have a medication in your body at higher than intended levels, then you're going to be increasing your risk of adverse effects and in some cases toxicity, specifically for medications that can, where their drug level needs to be really tightly controlled. So like I said, CYP3A4 is going to be involved in the metabolism of many medications. So kind of a classic one that many people are taking would be some statin medications for lowering cholesterol. So if you're taking an herb that inhibits CYP3A4, then your risk of having side effects from that statin, such as muscle aches and pains, or even rhabdomyolysis, which is a more severe form of muscle injury, your risk is going to go up.
That sounds like it's really important information, so we are going to be looking forward to being able to find that at examine.com. Katie Jantz, thanks so much for talking with us on the People's Pharmacy today.
Thanks so much for having me. It was great to talk with you guys.
You've been listening to Katie Jantz, pharmacist and researcher for the informational website examine.com. They cover a wide range of supplements and review the medical literature for randomized controlled trials on both effectiveness and safety.
After the break, we'll talk with pharmacist Dr. Stephanie Ferrari about interactions between herbs and pharmaceuticals.
Did you know that a lot of important medications were originally derived from plants? Metformin and digoxin are among the best known.
We'll explore how grapefruit and grapefruit juice interact with drugs, why you should care.
Pharmacists have a treasure trove of information to share about interactions as well as many other aspects of drug treatment.
When people don't talk with their pharmacists, are they missing out? But modern drugstores don't make it easy.
Your pharmacist could help break down some of the silos we see in medicine.
We'll describe the benefits of a brown bag review and tell you how to arrange one.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Most health professionals, physicians, nurses, and pharmacists get a lot of education about pharmacology. They learn about the mechanism of action of medications as well as dosing and interaction information.
They get less information, if any at all, about natural products such as herbs and dietary supplements. What happens when patients take ashwagandha for insomnia or turmeric for arthritis, along with their over-the-counter or prescription pills? How can you combine supplements, herbs, and medicines safely?
To help us better understand this challenge, we're talking with Dr. Stephanie Ferrari. She is the Henry L. Smith and James L. Olson distinguished professor in pharmacy practice at the Eshelman School of Pharmacy at the University of North Carolina at Chapel Hill. She has served as chair of the Division of Practice Advancement and Clinical Education, with a research focus on advancing clinical practice in the community pharmacy setting.
Welcome back to the People's Pharmacy, Dr. Stephanie Ferrari.
Thank you for having me.
Dr. Ferrari, we have just had a wonderful conversation with a Canadian colleague of yours. That is to say, she's a pharmacist in Canada, Katie Jantz. She works at Examine.com, and they are focusing on supplements, quality issues, interactions, side effects, all of that. And my first question for you has to do with the fact that pharmacy has changed so much in the last 100 years. When my grandfather was practicing, he was making a lot of compounding products. He was using herbs. In fact, he even had a big bottle of leeches on his counter, if you can believe that. Freaked my mother out, as you can only imagine. But it was mostly plant-based back at that turn of that century. Mm-hmm. And then 60, 70 years later, it was mostly pharmaceuticals. But now, if you walk into just about any pharmacy in the country, you will see lots of vitamins and lots of supplements. And I think a lot of times people just take them for granted. Hey, if you can pick it up without a prescription, don't worry, it's fine. This idea of the interactions between herbs and pharmaceuticals really does concern us. What about you?
Oh, it definitely concerns me. And I thank you for your story. You're exactly right. Pharmacy has changed throughout the years. But when you think about where did we get all of our pharmaceuticals that are now manufactured, they usually started from plants. There's lots of medications, heart medications, cardiovascular.
Digoxin,
that's the one.
Metformin.
Mm-hmm. So you just named two very popular medicines that are derived from plants, and they were basically side effects that we determined taken in larger doses that led to therapeutic benefits of them being manufactured as a pharmaceutical agent. So I think that's important for everyone to be aware of, that most of our products that we see today that are dispensed by a pharmacist did start as plant-based products, a lot of them, not all of them, but a lot of them. And there are also, to your point, a lot of plant-based products, dietary supplements still available in front of the counter. So the things you get behind the counter from the pharmacist are usually regulated by the FDA. They're manufactured from a pharmaceutical manufacturing company. But then there's also things in front of the counter that are not necessarily regulated by the FDA. And those are our dietary supplements. And they have drug interactions that we do need to consider. They can be nutrition interactions, interacting with food. They can also be drug interactions. They can also interact with one another. So it's really important that whenever I always say when you put anything in your body, whether it's in your mouth, in your ear, in your eyes, anything that has a chemical, plant-based chemical, natural chemical, that we check to make sure that that it is safe and appropriate for you.
Well, you mentioned food, and I would just like to take a little tangent to grapefruit.
Oh,
because that was really our wake-up call, that plants may have a powerful effect on the enzymes that our bodies are using to process the medications that we take. And of course, the grapefruit interaction wasn't taken very seriously at first by some health professionals. But it became clear that indeed grapefruit can have an impact on an enzyme that we have in our bodies called CYP3A4. And this enzyme, our bodies use it to process a huge number of the medications that we take. Tell us a little bit more about that, if you would, please.
That is right. All of the medications we take, including dietary supplements, have to be metabolized in our body, and they have to be eliminated out of our body. The main mechanism that they either get metabolized or eliminated are usually the liver and the kidney. And so the cytochrome 3A4 enzyme you just mentioned is found in your liver. And so when you take take a medication that is metabolized through the liver through that enzyme, and if you're eating grapefruit at the same time, there's competition in your liver for, is the liver going to process the grapefruit first, or is the liver going to process the medication first? And so that competition, and they both have to compete for that 3A4 cytochrome, and that's what leads to a drug interaction. And so you usually get elevated levels of either the drug that because it chooses to process the grapefruit first. And so that's what leads to side effects. And so many of our side effects are because there's either competition going on in the liver as we're metabolizing foods or drugs at the same time for those different enzymes that we're metabolizing.
One of the things that worries me, Dr. Ferrari, is that when my grandfather was a pharmacist, there were no clerks. I mean, he was the clerk and he was the pharmacist who was making the medicines.
I'm sure it was less efficient.
Less efficient, but very personal.
Mm-hmm.
And the town that I grew up in, tiny little town in eastern Pennsylvania called New Hope, Benny Seiden was the pharmacist and his wife Sarah was the clerk. And he knew everybody who walked in the door, and everybody, of course, knew him, and he always was going to chat with you and find out about what was happening with your family and who was doing what. And so whenever a medicine was dispensed, you had to talk to Benny if you wanted to get your medicine. These days, it's really different. I mean, maybe some independent pharmacies still have that old-fashioned flavor to them where you interact with the pharmacist, but now people grab and go. And there's just a technician out front. Unless you really, really try hard, you're not going to get a chance to talk to the pharmacist. Why is that a problem?
Thanks for bringing that up. And the reason I became a pharmacist is what you just described. I wanted to develop relationships with people in my community. I wanted to get to know their children. I wanted to get to know their grandparents. And a lot of community pharmacists have those same qualities that I have, that you really have a passion for relationship building. And that relationship building is what's important for, as you described, understanding all the medications you're taking, understanding how you live, what's important to you, what's maybe not as important to you. And so we all have, the way I like to describe it, is we all know the name of our primary care doctor. We know the name of our primary care doctor. We probably know the name of our dentist, too. We see them once, sometimes twice a year. But do we know the name of our pharmacist? And so that, to me, is really important to get to know a pharmacist, no matter where they work, really well, that you can develop a relationship with so that you can trust them and ask them the questions.
Well, I do know my pharmacist. Her name is Karen, and she's fabulous, but she's not always there because sometimes she's working on the weekends, and sometimes she's working the morning shift, and sometimes she's working the afternoon shift.
You know, the pharmacy is big enough. It's one of those chain pharmacies. It's big enough that they rotate people through.
And I'm very happy that you know the name of your pharmacist. That's wonderful because you know when she's not there, but you probably would know when she is there. So that's one thing, and pharmacy has changed. You know, there are so many more medications, and patients are getting older. I mean, we have a generation of baby boomers. As we get older, we take more and more medications. So there's more and more things for the pharmacist to do and fill, which is why you start to see those clerks. You start to see the technicians. Those are the pharmacist helpers. And so the pharmacies who do it very well is they'll have the technicians help with filling the medications, help take care of the patients. But the pharmacists are really there to answer any medication questions that you have. And I know that they look busy behind there. But let me tell you, if you say, can I talk to the pharmacist? They will pause and they will take time out of their day to answer the questions for you because patient safety is what's most important to those community pharmacists.
So don't hesitate.
Never. Please don't hesitate.
And one of the things that always worries us is that healthcare providers seem to be in silos these days. First of all, you have your medical specialties. So the ophthalmologist is not talking to the gastroenterologist, is not talking to the neurologist. And sometimes the medications that they're prescribing can interact with each other. So you got that. And the pharmacist might be the person who could pick up that problem. But the doctors don't always talk to the pharmacists. And then you've got nurses, and you've got researchers, and you've got alternative care practitioners, whether they're herbalists or chiropractors or what have you. and everybody is telling you something to do, something to take, and it can be confusing. What do we do?
It can be. And that's a great story that you share. And I think the one thing that I like to think through is many of those people are prescribing medications. And as long as a patient or you are using the same pharmacy, the pharmacist and the pharmacy is the one that has an accurate list of all your medication record. And so that's what's important, is that you use the same pharmacy so that that pharmacist can check for those drug interactions. So even if your, internal medicine doctor is not talking to your cardiologist, but if you're having the cardiologist and internal medicine doctor fill the medicines at the same pharmacy, the pharmacist, whether it's Kara or someone you don't know, should be able to review the prescription profile and be able to use software and be able to use their knowledge that they're taught in school to determine if those medications have interactions, whether they're safe and whether they're effective. And many times it's the pharmacist who's the first one who might catch something and then can communicate to the specialist or communicate to the internal medicine doctor. The challenge is when patients do not use the same pharmacy. And I understand that sometimes that happens because you might be a veteran and fill some things at the VA. You might have to fill some things at mail order. You might have to fill some things at your pharmacy. But making sure that you, again, talk to your pharmacist about every single medicine you're on. Try to fill them all there if you can. And if you can't, at least alert the pharmacist to all the things that you are taking. I'll also say that there is something, especially for patients who have Medicare. It's called a comprehensive medication review that should be done at minimum once a year. I would argue it should be done more than once a year. I think it should probably be done quarterly, but once a year, if you have Medicare Part D, you qualify through that Medicare Part D plan to sit down with a pharmacist.
With a pharmacist. Now, how do you organize that? Because Medicare gives, I suspect Medicare is giving doctors incentives, because if you are on Medicare, your doctor's office will say, you need to come in once a year for your wellness visit. But I've never had a pharmacist say, you need to come in for your medication review.
So it would depend on your Medicare Part D plan is what it would depend on, but all Medicare Part D plans do require a comprehensive medication review. It can be done by a pharmacist. It might be done by a nurse also. Physicians usually allow pharmacists or nurses to do it. They sort of pass on that responsibility.
They're not that interested in that one.
Right. They have other things going on. They have other skills that they can do much better than we can do. But we really want to focus on the medications. And so that's something that make sure you take advantage of.
One of the things that I worry about is that, the world seems very divided these days, whether it's economically or politically or religiously or whatever the category. And it seems like medicine and healthcare is also, because you go to a doctor, you're going to get a prescription for a medication. If you go to we'll say a functional doctor, you're going to get maybe a recommendation for an herb. And these two worlds don't often talk to one another, as we've already alluded to. So a person might be taking St. John's wort for depression, a golden seal, ashwagandha, berberine, ginkgo biloba, and
whoa.
When they start taking a handful of herbal supplements, they don't always tell their doctor. They're afraid that the doctor will look down his or her nose and say, you shouldn't be doing that. Mm-hmm. Or even the pharmacist may say, you don't need to be taking all those herbs. How do we begin to, break down the divide and let people be more honest about what they're taking, and then inquire about the issue that we've been talking about, which is the interaction potential? Because some of these herbs, including licorice, which is being used, can have a profound impact on potassium levels, especially if you're taking a diuretic like hydrochlorothiazide. How do we get that conversation started?
That's a great question. And again, when I was working and doing these medication reviews, I would make sure that I would gather that information from patients. Again, ideally, I would love if they filled it at my pharmacy. I know that they wouldn't always fill it at my pharmacy. And I would it's called a brown bag review, where I say anything that you put on or in your body put it in that brown bag and bring it to me, including dietary supplements, including eye drops, including ear drops, including any ointments. And that, by saying anything on or in your body, I really get them thinking about dietary supplements, food supplements, things that they can be taking. And it's created in a non-judgmental way. And really the question as a pharmacist, what we're going to be asking is, why are you taking this? What is it for? Is it helping you? And have that conversation. I find a lot of times when I do these reviews, sometimes people, A, don't know what it's for. I'm like, well, why are you putting it in your body if you're not sure what it's for? And then B, is it working? They're not always sure if it's working. And
if you don't know what it's supposed to be doing, you don't know what it is doing.
I would also interject that a lot of times that's true with medications.
You are correct. You are right. It can be prescribed medications that your doctor prescribed. It can be something that you just saw a commercial for and you're like, I'm going to try that. Let's see if it works. And you start taking it and you forget, why did I start taking this? And then it could be something else that a friend or a relative recommended. And so it's a good conversation to sort of have. And usually what ends up for me is I ask, how much are you spending each month on all of these things that you are paying for? And it becomes an economic conversation about, is this one you want to continue? Is this one you want to continue?
Is it worth it?
Is it worth it? And it's economics. It's also safety. And then it's effectiveness. Is it doing what it's supposed to be doing?
You're listening to Dr. Stephanie Ferrari, who holds the title of the Henry L. Smith and James L. Olson, Ph.D., Distinguished Professor in Pharmacy Practice at the UNC Eshelman School of Pharmacy. She has served as chair of the Division of Practice Advancement and Clinical Education. Her research focus is on advancing clinical practice in the community pharmacy setting.
It's time for a short break. In just a minute, we'll find out if hibiscus tea will interact with your cholesterol-lowering medicine.
Could that tea give you a nagging cough that's hard to shake?
How much do pharmacists know about herbal medicines and supplements?
Are they metabolized differently from medications?
Terry, often people think of pharmaceuticals as more powerful than plant-based products. Lately, though, questions have been raised about some drugs that have been on the market a long time.
If you have allergies or a cough, what can you take that won't interact with other drugs?
Pseudoephedrine is effective for allergies, but it could raise blood pressure for vulnerable individuals. Are you one of them?
You're listening to The People's Pharmacy with Joe and Terry Graydon. Welcome back to The People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Do you take any pills? I'm not just talking about pharmaceuticals. My own regimen includes a multivitamin, extra vitamin D3, curcumin for some aches and pains, especially before tennis, along with berberine and cocoflavanols. Terry also takes cocoflavanols, a multivitamin, magnesium, and synthroid.
Millions of Americans take statins, blood pressure pills, medicine to regulate blood sugar, and other crucial pharmaceuticals. In addition, lots of us are taking supplements. How can you combine supplements, herbs, and medicine safely?
Our guest today is Dr. Stephanie Ferrari. She holds the title of the Henry L. Smith and James L. Olson Distinguished Professor in Pharmacy Practice at the UNC Eshelman School of Pharmacy. She has served as chair of the Division of Practice Advancement and Clinical Education with a research focus on advancing clinical practice in the community pharmacy setting.
One of the things I get really excited about is when I am looking at the medical literature and I discover a fascinating interaction that probably not too many people are actually paying attention to. And my current favorite has to do with hibiscus. Now, hibiscus is this lovely red flower, and you let the flower dry and you make it into a tea. And it turns out that this tea lowers blood pressure. So you actually can use hibiscus tea. If you're consistent about it, you have to be consistent. You have to be taking your blood pressure and paying attention. You actually can use hibiscus tea to lower your blood pressure.
How much will it lower your blood pressure, Terry?
It does about as good a job as lisinopril.
So ACE inhibitors, our number one drug. Doctors love lisinopril, and you're telling me that agua de Jamaica, is that
See?
what? If we were in Mexico and there was a big jar in Oaxaca on the counter, and it was a beautiful reddish color.
Yes.
And that's hibiscus.
That's right. That's right. And it does lower blood pressure. So if you had some blood pressure concerns, you might be using hibiscus tea to help control your blood pressure. It turns out that aqueous extract of hibiscus flowers, which translates to hibiscus tea, interacts with simvastatin. It's the same as the grapefruit interaction. It hits CYP3A4, and it slows down the body's ability to process simvastatin. So, and frequently, people with blood pressure problems also have cholesterol problems. This is an interaction everyone should know about, and yet I think probably very few people do. How do we get the word out?
Well, you know what's so fascinating about this? People think hibiscus tea, oh, it's so benign. I mean, no worries, mate. And
of course, we thought the same thing about grapefruit, right?
Exactly. How could grapefruit possibly cause problems? And yet it has a profound impact on that 3A4 enzyme.
Mm-hmm. And I think about tea is a great example of thinking about medicines. You know, how did medicines start? Usually herbs that were dried out and then made into a tea. And they had medicinal properties. I mean, you look back to our Native Americans, look back to our culture, our history. So, you know, hibiscus is another example, is one example of many dry herbs that have a medicinal property. And again, when I think about our history, we didn't have simvastatin back there to be competing with
True
hibiscus. You know, now we have an environment where we're combining plant-based products, whether it's through a tea or through a capsule, through tablets. I mean, there's lots of ways that you can ingest dietary supplements with FDA-approved prescription products. And so one of the things that, and again, in pharmacy school, pharmacists are trained on drug interactions. We are trained on drug metabolism. We're trained on drug elimination. We're trained how medications work in the body. And do they compete with one another? Do they complement one another? Sometimes we take medications actually for complementary purposes. Sometimes we want to avoid those sort of interactions. So overall, the education, and there are drug resources, and that there's a lot of information out there. And I think that's what's confusing for someone who doesn't necessarily have a healthcare background of where do I find this information? If I wanted to use hibiscus every single day because I want to use it for blood pressure lowering properties, is it the best choice for me? If you're only taking that, perhaps that could be a great option. If you're on other medications, my red flag goes up and says, maybe I need to look into things. But then it's, where do I look for that information?
Exactly.
Well, you know what's so incredible to me is that people think, I've heard about this thing called the ACE inhibitor cough. So people taking lisinopril, as a for example, can sometimes get a cough that's just unbearable. And it won't go away on its own. You literally have to give up the ACE inhibitor. But sometimes they say, I developed a cough while I was taking hibiscus tea because it's also an ACE inhibitor. Oh.
It doesn't seem to be quite as common, and yet it does happen. So, I don't know how many patients or how many physicians or how many pharmacists might be, on the lookout for that.
Well, that raises the whole question of education.
Mm-hmm.
So you've talked about the interactions and all of the other ways pharmacists are trained these days in pharmaceuticals. How well are pharmacists being trained in supplements and herbal medicines?
So we have a class at UNC, at University of Eshelman, North Carolina, Eshelman School of Pharmacy, that deals with non-prescription medications and dietary supplements, the whole class dedicated to that. And when you compare medication classes among all healthcare professionals, pharmacists are probably the only one who do have an education in dietary supplements and non-prescription drugs, and that across all the schools. So that's where pharmacists are probably your best bet on asking first. I'm going to tell you, they might not know the answer off the top of their head. There's too many medications now. There's a lot of medications out there, prescription, non-prescription dietary supplements. So many times when patients would ask me, I'd say, I need to get back to you. I have to look into that. For example, your hibiscus story. I mean, I learned something there. I really didn't know that hibiscus was similar to an ACE inhibitor until you shared that with me. And so if a patient came in and shared that story with me, I'd say, I need to look into that. And so that's, I think, something that we... in this world where we want instant gratification and instant answers, I would much rather make sure that, again, a pharmacist is going to know which resources are reliable resources to go look for. And you might come in with some resources and they may be reliable, they may not be, but we can confirm or we can build upon that. So be okay with that.
I'd like to change gears just a little bit. You talked earlier about how medications are metabolized in the liver and also excreted through the kidneys. And there is a classic example that has been making headlines. It's phenylephrine, abbreviated PE. It's an oral decongestant. It's been on the market for many, many, many decades, forever. It's in hundreds of products. Americans have spent tens of billions of dollars over the last 50 years.
Myself included.
Yes. In all of these multi-symptom cough, cold, and allergy remedies that have a decongestant, PE, used to be, pseudoephedrine, but that's gone. It's behind the counter. You have to ask the pharmacist for it. So the FDA has, after 50 or 60 years, decided that doesn't work. And the reason it doesn't work is it's not absorbed into the bloodstream. I read something, what was it, Terry, just the other day?
What you read me was that it was just 1% of the phenylephrine that you ingest makes it into your bloodstream. Well, that's really very, very little. And something that I had read before said if you take enough phenylephrine orally to have a decongestant effect, that is enough to give you some pretty unpleasant side effects.
Yeah, and what you're talking about is something that, so you're right, I mentioned before the metabolism and excretion. The other two parts that pharmacists are trained in are absorption and distribution of medications. So you're hitting on a medication that, when taken orally, if it cannot be absorbed. Now, it is great when it's used as an eye drop. It is wonderful as an eye drop. So phenylephrine is great as an eye drop. It works well as a decongestant, also as a nose drop as well, or a nose spray or a nose drop. But when it's taken orally, it does not get absorbed in the GI tract. And it has been proven that really oral PE or phenylephrine is not an effective oral decongestant. And so you'll probably start hearing it was removed from the market with products that only had phenylephrine alone, but now they're starting to have conversations with the multi-symptom or multi-ingredient combination products that they're starting to think about removing those from the market too.
But it's going to take a while.
It will.
Two pharmacists, Dr. Randy Hatton and Dr. Leslie Hendels, down in Florida, have been lobbying the FDA for a couple of decades. Like, this thing doesn't work. Get it out of there. And the FDA has finally, we can't say they have taken action, but they are taking action, and it will take a while.
They're contemplating action.
Right.
There was a vote, and that was a unanimous vote from my colleagues saying that it should be removed from the market, and now the FDA is contemplating what to do.
Contemplating, but it could take a while. So that leaves us with cold and cough season, and what do people do when they come down with an upper respiratory tract infection? There are also questions, to be very honest with you, about the effectiveness of dextromethorphan, the DM in all I will say virtually all cough medicine. And there's some issues about guaifenesin, which is the mucolytic that's supposed to break up mucus in your nose, in your lungs. So, give us a quick insight as to what works, what doesn't, what we shouldn't be doing if we come down with a cold or the flu this year.
My favorite quote that I use when I was teaching my students about this is, if you treat a cold, it lasts 7 days. If you don't treat a cold, it lasts 7 days. So it doesn't matter whether you treat it or don't treat it, you're going to have a common cold for about 7 to 10 days. Really what you're treating are the symptoms and making yourself feel better during those 7 days. If you have to go to work, okay, I need to make it through a work day. I need to treat this symptom. So I want to make sure people understand that there is no magic cure for treating a common cold. It just has to run its course, and it takes about 7 to 10 days. Now, with that said, if you want to treat your symptoms, typically what bothers people the most is the stuffy nose or the runny nose. So a runny nose, an antihistamine, a drying agent, is what's going to help you. Probably the most common one people are familiar with is diphenhydramine, or the brand name is Benadryl.
But don't drive.
I was going to say, but I don't recommend that in all patients because it does have drug interactions. It does cause sedation. You can't, if you're operating heavy machinery, driving, older adults, yeah.
Exactly. If you're trying to get to work, or if you have to pay attention to anything at work, which most of us do, Benadryl's not really the best.
It is not. It is good for before bed.
Yes.
If you need a good night's sleep, that is a great thing to take before bed to get a great night's sleep. So really, runny nose, there's not a lot you can do, unfortunately. A stuffy nose, you mentioned before, pseudoephedrine, is a great option. To your point, though, it's available behind the counter, not in front of the counter. It is accessible. You just have to, again, ask the person in the pharmacy if you can get your pseudoephedrine to help with that stuffy nose.
Any interactions to be aware of with that one?
There are some interactions. Again, there's always going to be interactions. So patients who have high blood pressure, especially if they have uncontrolled high blood pressure, I typically don't recommend it.
Oh, by the way, there was an article just recently that said 40% of Americans with hypertension don't know they've got it.
That could very well be true. So that's one question I asked. Do you know if you have blood pressure?
And most pharmacies now have a blood pressure monitor device right there. So maybe before you take the pseudoephedrine, get your blood pressure measured right here, right now.
Mm-hmm. So I do, and there's other drug interactions as well with pseudoephedrine. It can interact with some antidepressants. It can interact with anything. It's a stimulant, so it can really increase your diabetes. It can raise your blood sugars. So if I'm talking to someone who has a chronic condition, they usually have diabetes or hypertension or high blood pressure. So it might be just one of those where I usually recommend is like a nasal spray. That could be something, but again, short-term use, 2 days for a nasal spray.
Because
it would actually make your congestion worse if you keep on taking it. It's called rebound congestion is the simple way of saying that, but it's your body gets used to the, basically, it causes rebound congestion.
Well, we've just got about a minute left, and I'm thinking Helen Graydon's chicken soup.
Yeah. That's our usual go-to. If somebody gets a cold, just a big pot of chicken soup, a nice hot cup of chicken soup will actually clear out your congestion short term, not long term. Mm-hmm. But we're talking symptomatic, and it'll make you feel better short term, and it won't make you any worse. And it won't interact badly with your medication.
And that is, of course, my mother's famous recipe. And there was always lots of garlic in there.
Lots of garlic and plenty of thyme. And the thyme is helpful against a cough.
It is.
So there's a lot you can avoid. Mm-hmm. It won't make a difference on how fast you get better. And the chicken soup tastes delicious.
And chicken soup, tea, humidifiers. I'm a big advocate for non-drug therapies. So humidifiers, vaporizers, those are the big things.
And talk to your pharmacist.
Yes, and get to know your pharmacist about any drug interactions and how they can best make you feel better.
Dr. Stephanie Ferrari, thank you so much for coming to talk with us at the People's Pharmacy today.
Thank you for having me.
You've been listening to Dr. Stephanie Ferrari. She is the Henry L. Smith and James L. Olson Distinguished Professor in Pharmacy Practice at the Eshelman School of Pharmacy at the University of North Carolina at Chapel Hill. She has served as the chair of the Division of Practice Advancement and Clinical Education with a research focus on advancing clinical practice in the community pharmacy setting.
And Joe, the information about phenylephrine is pretty important.
Well, it is because it's still found in so many over-the-counter allergy drugs as that decongestant. And by the way, while it won't work orally, Dr. Ferrari mentioned that it does work in eye drops, it does work in the nose when it's topical, but there's another place. Hemorrhoid remedies. And people who are susceptible because of hypertension can have their blood pressure go up.
You have to be careful about that. Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
Today's show is 1425. You can find it online at peoplespharmacy.com. That's where you can share your comments about today's interview. You could also reach us through email. We're radio@peoplespharmacy.com.
Our interviews are available through your favorite podcast provider. You'll find the podcast on our website on Monday morning.
At peoplespharmacy.com, you could sign up for our free online newsletter and get the latest news about important health stories. When you subscribe, you also get regular access to information about our weekly podcast, so you can find out ahead of time what topics we'll be covering. Speaking of the podcast, we'd be grateful if you'd consider writing a review of the People's Pharmacy and posting it to the podcast platform you prefer.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.